Have you ever had neck pain so bad that you can barely look up or maybe turn your head left or right? Or maybe it's happened on a Saturday and you can't get to somebody's office to be treated. Or even worse, you did it on vacation and there's nobody around to help you. If so, this video is going to be great for you. I'm Dr. Putney with Wellington Family Chiropractic. And today I want to talk about acute neck pain and what to do when it happens to you. So I am at the beach this week, and we are with another family, and my buddy hurt his back. Now, luckily for him, I was here to help, but it got me thinking, like, what would you do if you're somewhere that you're not normally at and you can't get to your chiropractor or your PT, and all of a sudden you've got one of these episodes where you can just barely function, and you've got a week of vacation ahead of you and you don't know what to do. So today I'm going to talk about what to do when you have acute neck pain to the point where you can barely turn your head or rotate your head or look up at all. So the one thing that I always notice with my neck pain patients is they are borderline freaking out about it. And that's warranted because it can be very painful. But I mean freaking out in the terms of they feel like something very bad is going on. I have a lot of time, it seems like a lot of times my neck pain patients tell me if I couldn't get in here today, I would have went to the ER. It was that bad. Typically, you do not need to go to the ER over your neck pain. The majority of the time, neck pain is just a musculoskeletal condition. Something's happened with a joint in your neck, and it's very angry, and it's making your life miserable, but it doesn't mean anything too serious is going on. So try not to worry too much about moving your head or neck. A lot of times people just freeze up. They don't do anything all day. They don't move their head or neck because it hurts so bad, because they're afraid something big is going on, but that's usually not the case. So the first piece of advice I would give you is to just relax about it. It's common and it happens to the majority of us. You just need to know what to do next. So what I typically tell people is not to try to remain stationary. You don't need a neck brace. You actually need to move your neck. And the majority of people need what's called extension. In other words, pulling your head back into what we call retraction. So from the side, that would look like my chin going here. Now, there are a lot of different movements you can try, but the majority of people respond really well to sitting up in a tall chair and retracting their chin straight back. So again, I'm not tilting my head up. It is your head is just boom right there, like a nice double chin for a picture. And what I have my patients do, or what I would tell you to do, is, tilt your head left or right, rotate it, look up. It's going to be limited because you're in a lot of pain. And then do, as deep as you can, do about 10 cervical or neck retractions, chin just straight back. It's making my voice sound funny. Do 10 of those and then recheck your range of motion. A lot of times people find, hey, my range of motion's a little better. My neck's not spasming like it was a few minutes ago. If it begins to loosen your neck up, the more you load those joints in your neck into extension or with retraction, you're onto something. And then from there, what you're going to want to do is continually do that until your range of motion is back to normal. Once you've restored your range of motion back to normal, at least close to it, you then want to be doing 10 to 15 cervical or chin retractions on the hour. Now, sometimes if it's a really bad case, you might want to do them about every 30 minutes. So step one, try to remain calm about it. Don't completely lock up. 2, start moving. Usually you're going to need extension through retractions. And then step 3, avoid aggravating it again through bad positions. So a lot of times people, they're sore, I get it. They don't want to move, they don't want to walk around. So they'll just post up on the couch and they'll prop their head up with a pillow. And so their head will be just whoop, way out here. Now when you're sitting in a chair or on the couch, that might feel good at the time, but as soon as you get up, it's going to be worse. Typically, rest doesn't help these type of things. If you're going to rest, you want to sit up in a nice neutral position with your head just over your shoulders. You don't want something jamming your head forward, and you don't want to spend a lot of time. It's not the day to be spending time on your iPad or your phone. You want to avoid getting your head out in front of your shoulders too much. So realize what's going on is common. It's typically not a big deal. Begin to move it. Typically, you need retractions first. Do it until you restore your range of motion. And then 3, try not to aggravate it through bad positions for long periods at a time. That's what I would do if it was my neck. That's what I have my patients do. I coach them on this all the time. You've got to get it moving. And a lot of times you can get through the weekend without it ruining your weekend, and you'll feel a lot better within 24 hours. So I hope this helps you guys out, and I'll talk to you soon.